Hi. Welcome to Homeopathy Medicines. Today in this classic Homeopathic Materia Medica lecture discuss about homeopathic medicine Conium maculatum by Dr. Farrington, MD. Before starting this video, please subscribe to this channel. We need support from you to make this channel more beautiful and more informative. Now going to discuss about Conium maculatum, its uses and symptoms. Conium maculatum acts as a depressor on the cerebrospinal system. It develops a paretic state which spreads from below upwards, the lower part of the body giving out before the upper. When the drug is taken in poisonous doses, we find at first a difficulty in walking as though the legs could not be moved. As the action of the poison increases, other and more vital organs are involved. The lungs are attacked, there is dyspnea, the pulse is irregular, showing the fitful condition of the heart muscle. Up to this time, the mind of the patient is perfectly clear. Finally, unconsciousness ensues and the patient dies of cerebrospinal paralysis. We may utilize Conium in those exhausted states of the system resulting from old age. It may also be used after severe diseases as diphtheria and typhoid fever, and for the sequelae of that vice of vices, masturbation. In the paralyses of Conium, sensation is but little involved. Its analog here is gelsemium, which produces functional motor paralysis and is a prominent remedy in post-diphtheritic paralysis. In the treatment of the effects of sexual excesses, we find Conium of great utility by reason of its mental symptoms. It produces a perfect picture of hypochondriasis. The patient is melancholy. Conium may also be given when this mental condition arises from celibacy. Zinc oxide is here very similar to Conium. The latter is a depressing remedy, while the former is irritating as well as weakening. You may use Conium in vertigo, when it is the result of cerebral anemia and when it is characterized by exacerbations on turning over in bed. It is often associated with a numb feeling in the brain as if that organ was stupefied. Acting as Conium does upon the glandular system, we would expect it to be a scrofulous remedy. It is indicated in scrofulous ophthalmia, a characteristic symptom calling for it in this trouble, being intense photophobia disproportionately severe to the degree of inflammation present. In addition to this, there are ciliary neuralgia and prosopalgia, usually on one side, and worse from cold, under the influence of which the cheek becomes of a dark red color and swells. Conium affects the wax in the ears, increasing it in quantity and making it a dark color, something like chewed up paper. The proper treatment in these cases is to remove the accumulation of wax by careful syringing, and then give Conium to prevent its formation anew. Conium does not act very prominently on the chest. We find it useful in consumptives when they find it impossible to expectorate the sputum, they must swallow it again. It is especially useful for tormenting day cough. Conium weakens the heart, causing the pulse to be one moment full and regular and the next soft, weak, and irregular. This symptom is not an uncommon indication for Conium in aged people. The use of Conium in glandular diseases and in malignant forms of tumors comes from its power of producing enlargement of the glands, adenomata. The glands affected are of a stony hardness. These indurations are quite common in the mammae, in the testicles, and in the uterus. Usually, there is little or no pain, although, sometimes, there may be darting pains. Conium is indicated, perhaps, in the beginning of stress. It is also indicated after contusions or bruises when induration is the result. There is an inflammation of Conium which closely simulates that of malignant disease. In the mouth it gives us a picture of noma, the tongue and mucous surfaces are swollen, with offensive discharge, the parts have an ashy, grayish hue, and may even be gangrenous. There is great difficulty in swallowing, with spasm of the throat. In cancer of the stomach, there is vomiting of blood, and of a grayish-black substance which is made up of decomposed blood and broken-down gangrenous tissue. Conium is complementary to nux vomica in constipation, especially when there is faint feeling after stool. Ammoniacum gummi is a gum obtained from a very large tree growing in Arabia. It has gained quite a reputation as a cure for diseases of the eye. I have used it successfully in asthenopia, when the eyes smart and burn, especially if used at night by artificial light. The eyes become injected, and often throb, especially in the inner canthus of each eye. It thus stands between belladonna, which is used for affections of the eyes from overwork when there is great congestion, and ruta, which is indicated for irritability of every tissue of the eye from overwork or from using the eyes on fine work. Thanks for watching this video. If you want more videos like this, please subscribe to this channel and press the bell icon. Comment us your feedback. Like and share this video with your friends and family. For paid and free consultancy online, visit homeopathymedicines.com and mashclinic.com. Thank you. Have a nice day. Stay healthy, stay happy.